Redditors who have had major health issues, what small symptom should you have looked into earlier? I owe my life to my barber. When I was 17 he noticed a mole on the top of my head and said I should get that looked at. Two things could have happened here. 1. I could have brushed it off. 2. He didn't have to say anything. Anyway, I went to get it checked out and ended up having it cut out with a scalpel. Turns out that it was cancerous, but at the very early stages. They did a little more cutting and were able to get everything out. Almost 20 years ago, and life is good. Increasingly painful periods and nasty PMS symptoms in general. Family doctor attributed the change to age and just wouldn't take it seriously. After a year of complaints, the doctor prescribed birth control pills, which did nothing. After 2 years I finally lost it and cried in her office. The cramps had gone from this is a bit more than usual to full-on WTF 8/10, white knuckle puking level pain. I asked to please be referred to an OBGYN. When the gynecologist examined me, he also did an ultrasound in the office. He took one look at the screen, told me I could dress and he'd be right back. When he returned, he was carrying his surgery bookings schedule. A few weeks later I had a total hysterectomy and bilateral salpingectomy, tubes out. It would usually take up to a year to book that surgery, but he said he absolutely had to find me a spot. He was horrified I hadn't been seen much sooner and described my uterus as more tumor than healthy tissue. It looks more like a raspberry than a pear. Fortunately it was just benign fibroids, but it taught me a lesson. If something hurts, get help. Yell if you have to. Anything that is persistent. If it's not going away, it's not just anything. It needs to be looked at. Persistent, raging heartburn. I was young and dumb and uninsured, so I put it off. I put it off for nearly 3 months, by which point I was subsisting on plain yogurt and lentils and still having extremely painful bouts of heartburn and vomiting. I had lost a lot of weight and was consistently exhausted and in pain. Finally went to the doctor. It was a raging case of H. pylori infection. It was cleared up with antibiotics, but my doctor warned me at the time that I had probably caused irreversible damage to my stomach and digestive system by waiting so long. She was right. Within a year, the heartburn was back, along with the nausea and vomiting. I essentially gave myself a chronic disease by ignoring the initial infection. Moral of the story: if it keeps coming back, don't ignore it. What could have been treatable before will turn into something worse. Just if anything suddenly changes without any reason, I think everyone should take the time to really know their own body, all your own little lumps and bumps and processes, etc. Everyone is different, so you can never rely fully on what experience someone else has had with illness. If something starts being different, with no obvious reason for it, get it checked. Better safe than sorry. I realized this when I was 18, a seemingly healthy 18 years old woman, and one day, my periods just stopped. I thought nothing of it, cause no periods equals yay. A year later, I received a stage 4B cancer diagnosis. In my particular case, my periods stopping was the first physical symptom I had. Other, more obvious, for cancer. Anyway, symptoms came much later, but it was extremely likely the cancer would have been detected a lot faster if I had gone to the doctor and investigated why the periods had stopped in the first place. 11 years clear as of the 10th of April. I was much taller than my family. Family are all around 5 feet 5 inches, but I was 6 feet 5 inches by high school. We always joked I was a freak or won the genetic lottery. Went to my father's doctor for a physical, who noticed the swelling in my hands and ran a blood test. Turns out my growth hormone levels were about 3 times the normal amount. I was diagnosed with acromegaly. Got an MRI which showed I had a tumor on my pituitary gland. Got it removed and was feeling better after a few years. My 2-year-old daughter, with hindsight, would lie on her left side on the floor randomly during the day. She walked with a wide step, and finally multiple diagnoses for constipation, abdominal embryonic rhabdomyosarcoma. After 54 weeks of chemotherapy strolling through an unimaginable medical heck, she is 4 and almost a year in remission and hard to keep up with. Like she's discovering everything pain-free for the first time. That's so scary. Poor kid. My sister started to get frequent migraines just after she turned 22. Frustratingly, she did look into it. They happened more and more often. She went to the doctor, who waved it off as stemming from stress. Her husband had just been sent to Afghanistan. My mom pushed for a CT scan, which the doctor said was unnecessary. My sister went home without any kind of prescription and a suggestion to come back in a few months if it persisted. Well, a few weeks later, she had a massive seizure, got taken to the emergency room where doctors discovered a massive tumor in her brain and diagnosed her with a rare form of brain cancer. She died within a year. My mum had some light, like 1 or 2 drops, 3 times a year, spotting. For context, she was well past menopause. She mentioned it to her GP and he sent her for a test. Uterine cancer. Caught it at stage 1 before it spread, so was able to have a hysterectomy without needing chemo or radiation therapy. Thank Christ her seemingly small and insignificant symptom was checked out. Glad it was all okay. For the benefit of anyone scrolling though, spotting past menopause is a weird sign and usually indicates something bad going, like uterine or cervical cancer. I don't think you'd classify this as an illness, but I would clean my ears regularly, yet whenever I went to the doctors, they always said there was too much wax and couldn't see anything. My ears tended to hurt frequently and I had a hard time hearing for years. In high school, I went to a doctor who, as usual, checked my ears. Instead of just brushing it off and saying I need to clean more, she decided to do a total flush. Took 2-3 hours total to get both ears cleared, and when we were done, she discovered I had an ear infection that was most likely a year old. As a result, I can't hear well out of either ear, but that ear in particular has more hearing loss than the other. We also discovered why I had such an abundance of earwax. We had already figured out I had hyperhidrosis, overact sweet gland, and that also caused my ears to make more wax. I have been instructed never to use Q-tips again, it just cakes the wax to the sides of my ears, and I go see a doctor once a month to have them flushed. So, had we just had a doctor flush my ears probably 5 years sooner, I wouldn't have such hearing loss. Not me but my 9-year-old son. Last summer he complained about leg tiredness and slept a lot. Our pediatrician couldn't find anything wrong with him. Fast forward to January 2017 and suddenly he's constipated and his bladder is retaining enormous amounts of urine. We took him to the local children's hospital and they felt that his constipation was keeping him from releasing urine, so they hit him with gallons of Miralax mixture to get him moving. He pooped quite a bit but nothing really changed. After a week of this at the hospital, my wife lost her mind on the hospital staff and demanded that they think outside the box. The neurology department came in and did an MRI, and they found that he had a fatty phylum at the base of his spine which presented as a tethered cord. They operated immediately. Unfortunately now, the damage is done. My son no longer has bowel or bladder function because of the nerve damage caused by the tethered cord, so we have to use a straight catheter on him 6 times a day and keep after his bowels with stimulants, laxatives and enemas. We will be entering a clinic in May where they will run a series of daily x-rays and enemas to arrive at the mixture we will need to use going forward. Poor kid will have to live with this the rest of his life. My wife and I are sick over it. If the issue had been caught sooner, he might not have to deal with this. If we had waited longer, it's possible he could have lost the use of his legs. I have neurogenic bladder bowel. He will get used to cathing and doing bowel routine. Besides the occasional bladder accidents and UTIs, you get used to it. Feel free to reach out if you have any questions. I started craving iceberg lettuce like you wouldn't believe. Like I'd wake up in the middle of the night and go to the fridge just to eat handfuls of lettuce. At my worst, I was eating an entire bag of iceberg lettuce a day. No dressing or toppings. Just munching on it like it was popcorn at the movie theater. Finally decided I should drag myself to the doctor for a few blood tests, assuming I was a bit dehydrated or vitamin deficient or something. My hemoglobin was 5 when it should be 13-16. Ideally, my ferritin, iron stores, level was 1, which is literally as low as the test goes. I went straight from the doctor's office to the hospital to be admitted for 2 blood transfusions and an IV iron infusion. The hospital staff couldn't believe I'd been walking around and even working overtime with a level that low for months. Within 24 hours of my blood and iron transfusions, my lettuce craving went away. Not me, but my childhood best friend. She had this thing where her hand would spasm. It was kind of like a hand tremor. I just assumed that it was a tic, since I have a similar one, knee bouncing up and down, when I get nervous. Once, when I asked her about it, she said that she had pins and needles, so I also considered that she might just be shaking it off, even though the tremors were obviously an involuntary movement. That's really all there was. There were no other symptoms. She was fine for a really long time and then, suddenly, she just rapidly declined within the space of 24 hours. We were in class when she went down and started seizing. Just as quick as she'd gone down, she was awake again and fine. My teacher took her to the nurse and the nurse called her parents. I've had to work hard to try and not be angry at the fact her parents chose to take her home that night instead of taking her straight to the emergency room. She had a headache, so they gave her ibuprofen and put her to bed. She died sometime in the night of an undiagnosed brain tumor. Often, brain tumors are misdiagnosed as psychiatric issues. So if you notice a rapid decline in your mental health stability without any clear reason, or even with a reason, get a scan done. When I first started having severe episodes of depression, 16, my psychiatrist sent me in for a drug screen and an MRI of my melon. He told me that the first things he looks for in any patient with no extensive history of mental health issues is drugs and tumors. If you have testicular pain, don't frick around. Seek medical attention immediately. I had testicular torsion and got lucky. A lot of men have lost a both testicle to this. First friend. He was a Finnish carpenter and was hand sanding in a deep shelf area and got a splinter, more like a sliver of wood, into the cuticle of his pinky. It was pretty freaking big and he was like, it'll work its way out on its own. So, he left it alone. And a red line started to move along his arm from his pinky, up into his armpit. He finally got convinced to go into the doctor. Turns out the red line was an infection traveling along his vein, and had he not gone into the doctor when he did, they said the infection would have ended up in his heart and would have been extremely life-threatening at that point. The second me, my best friend was in the hospital. Eventually he ended passing, but all the stress of him in the hospital and continuing on with his passing, I was beginning to have gnarly cramping and waking up to use the bathroom like every hour or two. And not only that, but waking up almost crapping myself and then spending more and more time on the shitter each time, like having the urge to go without being able to go after initially going. Long story short, ended up with a pretty severe case of Crohn's disease, and ended up having some pretty serious 6-hour surgery to remove part of my intestine, bladder, and colon. Yay. Not me, but my wife. She had a rare liver disease that sprung out of nowhere when she was 23. Her initial symptom wasn't jaundice, yellowing of the eyes, skin, like liver diseases tend to start showing themselves with, but extreme itchiness. She figured it was just really dry skin. Turned out to be PSC, primary sclerosing cholangitis, but she's 2 years post-transplant and doing great. I experienced a pain in my left shoulder, trapezius muscle, whenever I consumed alcohol, which for me was an infrequent beer. It was odd, but not too concerning, since I didn't drink very often. Turns out, I had Hodgkin's lymphoma, and the pain in lymph nodes on the consumption of alcohol was a symptom seen in only a very small percentage of cases, less than 5%. My dad has a lot of moles and my mom forced him to go to the dermatologist because he hadn't been in years. She was worried about a few of the big moles that she thought might be getting bigger. The dermatologist pointed one out and asked if that was one they were concerned about, and no. My mom said that one actually seemed like it was getting smaller, so why would she be concerned? Doctor informed my parents they were doing a biopsy right there and then and cut a 1.5-inch long chunk out of my dad's back. It was melanoma, the really bad skin cancer. It turns out, if a mole is getting smaller, it's probably because the immune system has a reason to attack it. This was actually my mother, but it's good to know if you're a woman or no women. If you've been through menopause and your period comes back after over a year, get it checked out. It's probably nothing, but it can also be something. My mother is fine, fortunately. Yes, my mother had some spotting last year, over a decade post-menopausal, and it turned out to be cervical cancer. Since she went to the doctor immediately, they did a hysterectomy, 4 radiation treatments as a precaution, and she's totally fine now. Not me, but my grandfather had trouble breathing for a long time. Nothing horrible, just shortness of breath, heavy breathing, etc. But he had to take care of my grandma. He went to the hospital when he started coughing, a dry cough. Unable to stop, they diagnosed cancer, aggressive form of lung cancer, and he died within 3 weeks. The doctor told us that if he had come earlier, they might be able to save him. My mother had a chronic cough for years. Every time she went to the doctor, he gave her an inhaler and allergy medication. Never mind that she smoked over a pack a day and a sprain she had gotten wasn't healing. Once she started rapidly losing weight, I knew it was all over. That small pain that never seemed to completely go away just under the left side of my ribcage could have saved myself the horrible experience of acute pancreatitis. Pancreatitis suck. Pretty uncomfortable pain, and you have to go through almost a whole week without any food or drink. Source: I've had around 25 episodes in my life, from 1998 to 2006, the last one. Iron deficiency that doesn't get better no matter how much supplementation you take. I have Crohn's disease. Same, except celiac disease. I was so tired of DRs taking blood to check my iron that I started refusing. I told them yes, I'm anemic. I always have been. I've been on iron and iron builders for years. So, no more blood work unless you tell me you are checking for something else. I need my blood more than you do. I should have made more of an effort to get them to look for why. I was in my 8th grade and I vividly remember the day I noticed that I couldn't properly see with my right eye even with my spectacles, and I thought that maybe I need to get my eyesight checked because the power of my glasses might have increased. I didn't give it much importance because I had exams, and after 4 months when I finally went to get my eyes checked, the doctor informed me to get to a bigger hospital because he felt it wasn't normal. I went to a specialist eye hospital and they informed me that I was diagnosed with glaucoma and I had lost almost 90% of my vision in the right eye. Intraocular pressure, IOP, in the eye that should have been below 21 was 70, which is insanely high, and it was starting to affect my left eye as well where it was 23. They didn't know why I was diagnosed with glaucoma cause it is very rare at that age. I had to get operated in my right eye immediately because medication wasn't controlling the IOP. I missed half of the classes in my 9th grade, and then finally I had to get operated in my left eye as well in my 10th grade right before my final exams to control the condition. I wish I could have been more careful and went to the doctor immediately. I had problems walking as a child and had a big role in my gait. My parents and the doctor thought it was a foot problem, so I was taken to a pediatrist and given orthotics, which helped. However, this didn't fix my pronated leg. Doctors then said I had growing pains, so my parents ignored the pain for a while, especially since I never really had too many problems playing footy and cricket. I guess I just learned to put up with the pain. After 18 years of pain in my legs and feet, I had a physio figure out that my hips didn't line up and that it was highly likely that I suffered a hip dysplasia during birth that was not corrected. My right knee and foot are ruining themselves now as a result of my right leg being shorter than my left. My father, he would be working around the house or at his job and would just trip and fall for no reason. Happened 3 or 4 times. Long story short, it was ALS and he died from it just over 3 years after those initial symptoms. High resting heart rate. I had a Fitbit and didn't wear it for a few months. When I went back to it, my RHR was 90 plus from 54. Went to the doctor and found I was in hypertensive crisis with a BP of 212/104. I'm okay now but had a crappy Christmas thinking I was about to have a heart attack. A week before my 4th Halloween, I was playing on my cat in the hat scooter, fell on the pavement and got a good scratch on my knee. 24 hours later it starts itching pretty bad. Another 24 hours later I can't sleep, it's itching like crazy and getting red and hot to the touch. Mom thinks I'm being a drama queen. In her defense, I was a bit of a dramatic teenager and doesn't really look at it too closely. 24 hours later it aches so bad I can't walk and the itching and redness is worse. I end up in the hospital for a week with cellulitis that's so bad I come very close to amputation and or death. I had no clue at the time, but my mom said it was bad enough they told her to have relatives come visit just in case it was their last chance to do so. Doctor told my mom that if I had come into an office on the 1st or 2nd day I may have gotten by with just a strong injection of penicillin and a week of oral antibiotics. They told her to have relatives come visit just in case it was their last chance to do so. And that, my friends, is how you know how close you were to death. You have been visited by the romantic doggo. Comment lovers magic so you never fall in the friend zone. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.